Have you noticed something that almost every man over 50 experiences, but very few are willing to talk about? Your erections aren't gone. They're simply not the same. Maybe they don't arrive as quickly. Maybe they don't stay as long. Maybe they aren't as firm as they were 10 years ago. Or maybe you wake up one morning and realize those spontaneous morning erections that used to happen without thinking have quietly disappeared. Most men immediately blame one thing. My testosterone must be low. Others assume I'm just getting old, and that's exactly where the problem begins. Because aging alone is rarely the whole story. In fact, one of the biggest reasons erections gradually weaken has almost nothing to do with your birthday. It has everything to do with something your body was designed to do, but many men slowly stop doing. And if you ignore it for years, your body begins adapting to that lack of use, not because it's broken, but because the human body is incredibly efficient. If it believes something is no longer necessary, it slowly invests less energy into maintaining it. I'm Dr. Claire Morgan, and I help men over 50 understand the real science behind erectile health so they can stay confident, independent, and sexually healthy as they age. Today, I'm going to explain why erections often disappear with age, why so many men unknowingly accelerate the process, and most importantly, what you can start doing today to help preserve healthy erectile function for years to come. Some of what you're about to hear surprises nearly every patient I speak with, because the biggest enemy isn't usually age, it's inactivity. Your body only maintains what you continue to use. Think about your leg muscles. If someone spends 3 months in bed, those muscles shrink, not because the muscles are damaged, but because the brain realizes they aren't being used. The exact same principle exists throughout the body. Bone density, lung capacity, balance, flexibility, cardiovascular fitness. The body constantly adapts to demand. When demand decreases, maintenance decreases too. The penis isn't exempt from this biological rule. Although it's different from skeletal muscle, healthy erectile tissue depends on regular oxygen delivery, healthy blood flow, and normal tissue flexibility. Without those things, changes begin quietly, very quietly, which is why many men never notice the problem until it becomes difficult to ignore. What actually happens inside the penis? Most people think an erection is simply blood entering the penis. That's only part of the story. Inside the penis are 2 sponge-like cylinders called the corpora cavernosa. When you're sexually aroused, your brain releases chemical signals. Those signals trigger nitric oxide production. Nitric oxide relaxes smooth muscle surrounding the penile arteries. Those arteries widen. Blood rushes in. As pressure builds, the veins that normally drain blood away become compressed. Blood enters faster than it leaves. That's what creates firmness. It's an incredibly sophisticated hydraulic system. But like every hydraulic system, it needs maintenance. If circulation declines, everything becomes less efficient. Blood enters more slowly, pressure builds less effectively, firmness decreases, recovery takes longer. Eventually, many men begin noticing erections that seem unpredictable. Sometimes they're fine. Sometimes they're not. That's often one of the earliest warning signs. The silent changes that start after 40. Most men don't wake up one birthday suddenly unable to get an erection. The process is gradual. Beginning as early as the 40s, blood vessels naturally become a little less flexible. Nitric oxide production slowly declines. Collagen within erectile tissue changes. Elastic fibers become less resilient. Recovery after injury slows. Testosterone may decrease gradually. None of these changes alone usually cause major problems. But together, year after year, they slowly reduce erectile efficiency. Think of it like driving a car whose engine loses 1% of its performance every year. You don't notice it after 1 year, but after 20 years, the difference becomes obvious. Morning erections are more important than most men realize. Many men believe morning erections exist only because of sexual dreams. That's actually a common misconception. During healthy sleep, especially during REM sleep, the body naturally produces several erections. These aren't always related to sexual thoughts. They're part of normal physiology. Those erections deliver oxygen-rich blood throughout erectile tissue, almost like a scheduled maintenance program. Fresh blood enters. Waste products leave. The tissue stays healthy. Elastic fibers remain nourished. Smooth muscle receives oxygen. Doctors sometimes compare this to stretching a rubber band regularly. When something is repeatedly expanded and relaxed, It generally maintains flexibility better. When it sits unused for very long periods, it gradually stiffens. The same biological principle applies to many tissues throughout the body. The use it or lose it principle, this phrase gets repeated so often that many people dismiss it. But in medicine, there's genuine physiology behind it. Healthy erections provide periodic oxygenation of erectile tissue. Without adequate oxygen exposure over long periods, some smooth muscle cells may gradually be replaced with less flexible fibrous tissue. That process can reduce elasticity. Reduced elasticity makes it harder for erectile tissue to trap blood effectively, which makes future erections less reliable. Then something unfortunate happens. A man notices weaker erections, so he becomes anxious, he avoids intimacy. Sex becomes less frequent, natural erections occur less often, which means the tissue receives even fewer periods of oxygen-rich blood flow. The cycle slowly feeds itself. Not because the penis is permanently damaged, but because normal physiology is receiving less stimulation. Many men mistakenly think the answer is simply waiting until desire magically returns. Unfortunately, the body doesn't usually work that way. Activity helps preserve function. Blood vessels don't care where they are. Here's something every man should know. The arteries supplying the penis are much smaller than the arteries supplying the heart. That means reduced blood flow often appears there first, long before heart symptoms develop. That's why erectile dysfunction can sometimes serve as an early warning sign for cardiovascular disease. It's not just a bedroom issue, sometimes it's a vascular issue. High blood pressure, diabetes, smoking, elevated cholesterol, obesity, chronic inflammation. All of these damage blood vessels throughout the body. The penis simply notices earlier because its arteries are so much smaller. Ignoring erection changes may mean ignoring valuable information your body is trying to give you. Now, here's the encouraging news. Your body is remarkably adaptable. I've seen men in their late 50s, 60s, and even 70s improve erectile function. Not because they found a miracle supplement, but because they started addressing the real causes. The first step is restoring blood vessel health. Healthy erections begin long before the bedroom. They begin in your arteries. Regular physical activity is one of the most effective ways to improve circulation throughout the body. Walking briskly, cycling, swimming, resistance training. Even 30 minutes of movement most days of the week encourages blood vessels to become more flexible and responsive. Exercise also increases nitric oxide production, improves insulin sensitivity, lowers inflammation, and supports healthy testosterone levels. In other words, it works on several of the systems erections depend on. Many men search for one magic solution. Their body is usually asking for healthier blood flow instead. Your waistline matters more than you think. Another factor many men underestimate is abdominal fat. As waist size increases, several things happen at once. Inflammation rises. Blood vessels become less efficient. Insulin resistance becomes more common. Testosterone may gradually decline. Even a modest reduction in body weight can improve several of these risk factors simultaneously. This isn't about chasing a perfect physique. It's about creating an internal environment where your cardiovascular system and your erectile tissue can function properly. Sometimes improving overall health produces benefits that extend far beyond the number on the scale. Sleep is when recovery happens. Many men focus on what they eat or what supplements they take, while overlooking one of the most powerful forms of recovery available every night. Sleep. During healthy sleep, your brain regulates hormones, repairs tissues, supports blood vessel function, and allows those normal nighttime erections we discussed earlier. Poor sleep affects nearly every system involved in sexual health. Testosterone production can decline. Stress hormones remain elevated. Energy falls. Desire decreases. Recovery slows. If you're consistently sleeping only 5 or 6 hours a night, your body never gets the opportunity to fully perform its maintenance work. Protecting your sleep may be one of the simplest investments you can make in your long-term health. Don't ignore your pelvic floor. Here's something that surprises many men. The pelvic floor isn't only important for women. Men have pelvic floor muscles too. These muscles help support bladder control, but they also play an important role during erections and ejaculation. When they're functioning well, they help compress veins that normally drain blood away from the penis. That helps maintain firmness. Like every other muscle group, they respond to training. Simple pelvic floor exercises performed consistently may improve strength and coordination over time. If you've never practiced them before, speaking with a healthcare professional or pelvic floor therapist can help ensure you're doing them correctly. Sometimes a small improvement in muscle function can make a noticeable difference in confidence. The role of sexual activity. Now, let's address a question I hear almost every week. Doctor, does masturbation help or hurt erections? The honest answer is, for most healthy men, masturbation itself is not the problem. In fact, normal sexual activity, whether with a partner or during masturbation, is generally considered a normal part of sexual health. What matters more is the overall context. If masturbation becomes so frequent that it interferes with relationships, daily responsibilities, or causes physical discomfort, it's worth reassessing the habit. Likewise, if pornography use becomes excessive and starts replacing real intimacy or contributing to unrealistic expectations, that can create challenges for some men. But moderate sexual activity itself is not something most men need to fear. Healthy erections are a normal physiological function. The goal isn't avoiding them. The goal is maintaining the health of the tissues that make them possible. Stress can shut everything down. Even if your blood vessels are healthy, your hormones are balanced, and your physical fitness is excellent, chronic stress can still interfere with erections. Why? Because erections rely on relaxation. Your nervous system has two major modes. One prepares you for danger. The other allows rest, recovery, digestion, and sexual function. When you're constantly worried, working long hours, thinking about finances, or carrying unresolved anxiety, your body prioritizes survival, not reproduction. Many men notice that their erections return once major stress is reduced. That's not a coincidence. The brain is one of the most important sexual organs you have. Taking care of your mental health is taking care of your sexual health. Don't wait until it becomes severe. One of the biggest mistakes I see is waiting. Many men experience mild erection changes for years before asking for help. They assume it will eventually fix itself, or they convince themselves it's simply age. Meanwhile, conditions like diabetes, high blood pressure, low testosterone, medication side effects, sleep apnea, or cardiovascular disease continue progressing quietly. Early evaluation often identifies problems while they're still highly manageable. There's no embarrassment in bringing up erection changes with your healthcare provider. In fact, those conversations sometimes uncover health conditions that have nothing to do with sex and everything to do with protecting your future health. Here's what I want you to remember. If you're over 50 and your erections aren't what they used to be, don't immediately assume the story is over. Your body is constantly responding to how you live. Healthy blood vessels respond to exercise, hormones respond to sleep, weight responds to nutrition and movement, stress responds to healthy coping strategies. Even confidence grows when you understand what's actually happening instead of fearing the worst. Aging changes the body, but giving up on your health changes it much faster. Every healthy decision you make today sends your body a message. Keep maintaining this. And more often than many men realize, the body listens. If today's discussion helped you better understand why erections change with age, I'd love to hear from you. How old are you? And which lifestyle habit do you think has made the biggest difference in your health? Leave your answer in the comments below. I read as many of them as I can, and your experiences often inspire future videos that help thousands of other men. If you found this helpful, please like the video and subscribe for more evidence-based men's health discussions designed specifically for men over 50. Thank you for spending these minutes with me. I'm Dr. Claire Morgan, and I'll see you in the next video.